Welcome to another episode of the Fertility Conversations podcast. Today we are joined by an amazing guest, Dr. Babatunde Ogunniran from the Bridge Clinic. He joins us to tell us all we need to know about the Bridge Clinic Nigeria. So really excited to have you here with us. Thank you so much for joining us.
Thank you so much. Pleasure is all mine.
Yay, thank you. So we usually start off by saying, tell us a little bit about yourself.
All right. So you introduced me earlier and you got pronunciation quite well. That's great.
Yeah.
I love when you get pronunciation right. So my name is Dr. Ogunniran Babatunde. I'm a consultant gynecologist and also a senior fertility specialist with the Bridge Clinic. I happen to also be the head of clinic for the Lagos business unit. And this has been an interesting journey so far. We've been doing this for over 5 years now. And it's been a whole interesting environment because it's opened my mind to see great things, opened my mind to see and have a lot of experiences. I share some of these experiences sometime. Maybe when we have another discussion, we'll share a lot of these experiences. But it's been a great journey so far. Bridge Clinic has also been very, very instrumental in what it's doing in the world right now, not just in Nigeria and West Africa. And I think it's a privilege to be part of this journey. It's a privilege to be part of this family. And it's just been all good news so far. I think it's great time coming. So I feel fulfilled as a gynecologist at the Bridge Clinic and bringing these services to train people as well. And of course, spread the love to make people understand that, yes, this is a challenge that a lot of people deal with, but we're ready to help them and bringing that knowledge in from the background of a gynecologist. And as a senior fertility specialist, it's been very, very great.
Wonderful.
Yeah.
Thank you. Yeah. And you mentioned that you're with Bridge in Lagos, which yes, of course means that you have Bridge in different parts of Nigeria. Where are the other locations?
Yeah, so we have in Lagos, this is Ikeja here, GRA. We have Victoria Island. We also have in other states. So we have in Abuja, which is the capital of Nigeria and helps to serve the northern area, the north central area. Then we also have in Port Harcourt as well. All right, to also help people that are coming from either the southeast or south, so that we're central, we're all over Nigeria here to just reach out to people. And, you know, because of the way the cosmopolitan area where Lagos is, a lot of people because of traffic. So if you're on the island and you want to access treatment, we have the VI brand that is easily accessible. Then, of course, for mainland people that are here with us here in Ikeja, GR is very, very accessible from the airport. It's very easy to access and from other parts of Lagos.
Wow, amazing. It's great that you actually have so many locations because obviously sometimes people they don't want to come to Lagos, so they can't be in Lagos. So having other options is really important. And of course, even having the mainland and the island as well. Well done.
Yeah, thank you very much.
What are some of the services that Bridge Clinic offers?
All right. So we offer quite a number, and of course, we'll stay adding up to this number of services. I know majorly people just see us as a fertility clinic, but we do more than that. We do more than that. So we have services that help people to just check what your fertility state is. You're not really looking at fertility treatment. You just want to check. Oh, I'm 35 now. I'm 36. I'm not looking to get married yet. I want to just check myself, know how I'm doing. Or as a man, I'm planning to get married in the next 10 years. But let me just say how I look right now. So we offer fertility investigations for couples just to check how they're doing. So things like the fertility show like man, fertility show like woman, or even a couple that just got married, they just want to have a check. We have the fertility show like couple for them to just check themselves. And of course, going into the other services, ultrasound services are offered at the Bridge Clinic. And of course, going to the core services of fertility treatment, we offer different fertility treatment options. Of course, the IVF that is very, very popular. Of course, things like insemination and cryopreservation services as well. Very, very important to talk about that. We have a lot of people that have to go through maybe cancer treatment, all right? And because we know the effect of radiotherapy and the effect of these drugs, you want to make sure you want to cryopreserve your gametes before you go through this treatment, cancer treatments. Yes, that service is also available at the Bridge Clinic. So you can cryopreserve your semen, you can cryopreserve even your eggs, even as a woman. A lot of people want to build on their career now, and they might not have time right now. And we know that the age calendar is real, even for men actually, but more for the women, the age calendar is real. So you want to cryopreserve your eggs, those services are available. Even embryos, those are available as well. Then, of course, the aspect of the family balancing, we know that in this part of the world, of course, sub-Saharan Africa, a lot of people put pressure on having a male gender. I want to have a male gender as a child.
Yes.
Family balance is also important. So the aspect of pre-implantation genetic testing is also available for couples at the Bridge Clinic. I also know that, of course, the era of the genotype incompatibility is also there. So
Yes.
we know many years ago, once you tell your partner, oh, I'm AS, I'm also AS, I'm sorry, we have to break this relationship. Yes, and it came to a lot of love journeys, but that is not that doesn't happen again now. So it means that even people that are AS can actually get married and have children that are free of the sickle cell genotype. So the era of pre-implantation genetic testing, just short from PGT, is something we also offer at the Bridge Clinic. So, and of course, we're trying to add up a lot of services. We offer hysteroscopy as well. Hysteroscopy is just like a camera imaging to look at the womb itself. That's the inner part of the womb, just to check are there any abnormalities. All right, so those are available at Bridge Clinic, and of course, we are bringing up a lot of new things as well to add up to these services. So this is just about one of the few services that we do, but basically a lot of these things that we offer at the Bridge Clinic that is readily available.
That's a wide range of services. That's a whole lot.
Definitely.
It's basically, if you're looking at anything fertility related, you can come to Bridge Vet.
Definitely. The aspect of surrogacy just came to my mind now as well, because for every person that you see at the Bridge Clinic, every man or woman or couple that you attend to, there's always something unique about them. And of course, it's not one size fits all. There are some people, this is what they need. Some people will need donation services. Some people will need, of course, IVF treatment. Some people, of course, part of what we also offer, emotional management and counseling, of course, is very, very important, which is free, by the way. Free by the way, for people that come in to access service at the Bridge Clinic. So all this and many much more are coming through, and because we live true to our core values of being honest, being innovative, ethical, and being excellent. We always make sure that we bring things that will bring innovation, that will bring excellence, that always make people, of course, be able to access our services and have a complete whole well-being. That's why we're here.
So important.
Yeah.
And it's so important that people actually know that Bridge Clinic has all of this, because I think obviously in Nigeria, there's so many fertility clinics. So knowing the right one to go to can be quite challenging. So knowing that you offer such a wide range of services, and you also add the emotional counseling, which is very important when dealing with infertility and fertility treatment. So having that is a huge bonus.
Definitely.
How long has Bridge Clinic been there? Because I feel like you guys have been there since forever.
Yeah, I would say forever, because of course, before you see something, it's already been conceived in the mind. So it was there forever. And Dr. Richardson Ajayi, being our executive vice chairman, has conceived this for a very, very long time. All right. And since 1999, Bridge Clinic was established in 1999. So it's a wonderful time of the year, because we're going to be 25 years in 2025 and 2024 this year. So it's a long time coming. And over time, we've grown over time, all right, since 1999. And of course, all these services just didn't exist from the start. Over time, all these things joined, and with new people joining in as well. Of course, we know that there's a lot of change that happens in the staff and a lot of people that are coming in, going out. But over time, Bridge Clinic has grown. And even within that time now, we've had over 3,000 babies who celebrated over 3,000 live births already. So it's been quite a wonderful journey. A lot of milestones that we've achieved over these 25 years has been very, very wonderful.
Amazing.
Yes.
Looking forward to being a part of that. Hopefully we can attend.
We want you to attend. Be part of our celebration. We want you to attend, definitely.
Yeah. Thank you. So, of course, infertility, like we spoke about, is rising globally. It impacts men and women. But of course, oftentimes, lots of people are not aware that even male infertility exists. So when they do find out, or they do come to your Bridge Clinic and get tested, and if a man realizes that they have a male fertility issue, maybe azoospermia, oligospermia, or even varicose veins, are you able to assist with those situations?
Yes, so it's important you're mentioning this now, because many years ago, most people would always focus on the woman, and most of the time, the one man would just tell the wife, "Go and get yourself tested. I know I'm fine." But by the time they come in, they discover they have that huge shock, like, what is going on? And of course, it's now really becoming more important because now we're having a rising trend of male factor infertility. You have a lot of men that are coming in looking very fine, looking very handsome. By the time they're doing their test, you're finding out either they have problem with low sperm count or a lot of abnormal forms of the sperm cells. So there are a lot of things that come. And sometimes you even have the huge shocker of having no sperm cells in at all, what we refer to as azoospermia. And luckily enough, we've had quite a number of clients or male clients that have come in with this, but we're able to help them with the process of IVF. All right. So what IVF basically also helps us to do, in addition to just the IVF, is that we're doing a process called ICSI in addition with this IVF. What that means is that we're picking individual sperm cells to inject into eggs when we're doing our treatment process. So even with men that, for example, have azoospermia, where you're not seeing any sperm cells at all, there are surgical processes that we can do at the Bridge Clinic, where we can actually surgically collect the sperm cells from the testicles of the man. And this has been used to generate embryos, and would have live births and good success stories. We've seen a lot of men have come in and feel that they feel less than themselves because, of course, they've done tests before now, and they found out that their parameters are low, or for example, they're not even seeing sperm cells at all, and it's like, oh, what am I going to do? And in time past, people used to just opt for donor sperm, but we know that right now, because of this new services that are available, surgical collection can be done for the men. We can collect their sperm cells through surgical means, and this has been used to generate embryos that we transfer these embryos into the women, and we've seen, of course, good live births and good success stories from this. Now, even with men with low sperm counts, all right, no matter how low, I was attending someone recently, I said, no matter how low, we don't need 1,000 sperm cells for our process. We're not planning to collect 1,000 eggs from the woman. We're not planning to collect 50 or 100 eggs. So no matter how low, we've seen cases where you see very, 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 very severe forms where you can hardly count even 100. You're just counting per slide samples. And we're able to pick individual sperm cells with our technology where we are to date that. We're able to pick individual sperm cells, and this can be used to generate embryos to transfer for the IVF process and able to generate pregnancies and live births. So even for cases of varicocele that you mentioned, which means that there's a form of enlargement of the vessels, all right, that are surrounding the testicles, and this could also lead to low semen parameters in the men. Of course, once you produce and we're able to see, even though low motility, which is the low speed of the sperm cells, we're able to pick individual sperm cells. So for the low ones, we don't even have any challenges. Even for the ones that there are no sperm cells seen, we know that surgical option is available for them. Now, in some men where we have to now do the surgical collection and we do not get any sperm cells, then we can now resort to the donor sperm. But more often than not, if all the parameters are fine, for these men that have these challenges, definitely it's not a challenge. Once you come to the Bridge Clinic, we're able to help you. And of course, as I mentioned, because every treatment is based on what you need. All right. So if this is what you need, then definitely we're able to offer you. If you need surgical collection, we're able to offer you that. If it's the straightforward ICSI where you just produce your sperm cells and we can use that to inject the eggs, that is also available at the Bridge Clinic.
Thank you. And I think that's very reassuring for people, for any individual or couple listening, because oftentimes, again, when people hear or get a test done somewhere else and they say there's an issue with the sperm, they might even be they might not want to come to a clinic because they think, well, what are we going to do? But listening and hearing that there are options and it's not the end of the world.
Yeah, definitely.
There's still things that can be done.
Definitely.
That's very reassuring.
And it's quite very, very encouraging. I've had a couple now. They've come in about twice now, and we had to even do the surgical collection twice. All right. And we were still able to get sperms, and luckily enough for them, because of course IVF is not 100%, but luckily enough for them, the first happened, very, very beautiful, lovely baby girl. The second now is an ongoing pregnancy that it happened again. So it's not the end of the world. And I said, it's even infertility itself is actually one of the major causes of depression. When couples come in, they're looking frustrated, they're looking down, there's a lot of pressure. People are getting married, and we know the expectation is, so when I was seeing the baby bump. So it's a challenge, but when they're able to come in with, of course, with our support, counseling, emotional support, and with our treatment, we're able to put joy and smiles on a lot of families, and that's what we'll keep doing. Definitely, that we'll keep doing.
That's amazing. Thank you for all you're doing.
Thank you very much.
With male factor infertility, there's also another aspect that people wonder about, like DNA fragmentation test.
Yes.
Is that something that can be done at the Bridge? Because sometimes people say, well, just do a semen analysis. But some cases have been found that even the semen might appear okay.
Yes.
There might still be some fragmentation issues that could impact the embryo.
Yeah, so these are services are available as well. So at the Bridge Clinic, we use all our tests are done at an international standard organization certified lab. So ISO certified labs are what we use for all our tests. And sperm DNA fragmentation, of course, even though there are a lot of arguments back and forth as regards that, but this is something that is also available because sometimes, as you said, the sperm cells are fine, but there is a lot of damage in the DNA and a lot of these genetic things that are not obvious to just your basic analysis. So sometimes you have to do DNA fragmentation to just check the level of damage, sometimes to the sperm cells, and sometimes you're able to offer supplements or antioxidants that may help to improve the sperm parameters or the structure. And this may also help to improve, of course, the quality of the embryos you're able to generate. And of course, obviously, the pregnancy rates could be improved in some people because not all the time does this work. But of course, these are just a limited part of the services that we offer as regards investigations. A lot of other things can be done for the man as well. We can screen for hormonal tests. Sometimes you find out that some hormonal challenges are what is actually causing the sperm parameters to be low. And sometimes we can manage this as well. So a lot of tests that are available that you can do at the Bridge Clinic that makes you to just have a holistic approach and able to look at everything and able to offer what exactly they need.
I love all I'm hearing from you.
Awesome.
Amazing. People need to know this, right? Because again, you're just not sure. And when you don't have the information, you don't know where to go to, you don't know what's available.
Information is power, knowledge is power. So you
need to know.
Yeah.
And of course, earlier you mentioned about donor sperm, that might happen in some cases. So we know that donor sperm, donor eggs are being used by many people now across the globe. Definitely. And even people in Nigeria, or some people even coming from outside Nigeria, want to check with you. Do you have readily available Black donors?
Yes, so in our environment, definitely almost everybody's a Nigerian. And of course, we have couples that come off from all over the world. I've had clients from Canada, Ireland, and even from the UK quite a number of times for the US. And you know, the major problem, even for example, in the UK, we know with the advent of COVID, the NHS service, before you can get any basic appointment, you have to be on the waiting line for so many months. And we know that time is not on a lot of side of people. They still have to work to make this money. So most of the time they have to travel in. And because of also they're Nigerians, they want to get a white donor, for example, if actually we need donor X. So they have to come all the way to Nigeria. And of course, for the Bridge Clinic, we offer, for those that need it, we'll offer donor treatments for them. And of course, they're readily available. So there are screening processes that are done that we do for regularly for these donors to ensure that they are fit to donate. So because you're young does not mean you're fit to donate. There are a lot of screening tests they will have to do for them to even get them into the donor process or the donor program. So for couples that are coming in, there's a process of selection that we do to help them to understand what our process is as regards the donor treatments. And of course, for donor sperm, donor eggs, all these are readily available services. One, there's an indication for it, definitely. So you also mentioned that the treatments are getting on the increase now because there are a lot of people that are seeking fertility at older ages, people coming in at 44, 45. And I say, why am I not going to use my eggs? What, doctor, what are you telling me? But the reality is there because we know that as the age continues to increase, the number of eggs, the quality of the eggs that a woman has will continue to decline and reduce with time because of that age calendar. So sometimes it's something that has to happen, basically based on the indication. So this is important that we have this readily as a service that is available for couples that need donor gametes. So they are readily available because these are what we do. And this we've been doing for this number of years that has helped couples from all over the world.
Right. Okay. So important. Thank you for sharing. And again, like you said, in the UK and other parts of the world, Black donors are not readily available. So people want to see if they can access and if they know someone in Nigeria or they're able to get to Nigeria.
Knowing that that's prefer they want to come home. They'll just tell you
exactly.
They want to come home. Yeah, exactly. So it's a home away from home, and that's what we try to make available as much as possible, considering the environment, the temperature, and all those things. So it's a home away from home. When you're coming in, you're ready, you're feeling like, yes, this is your home and we're ready to accept and put you through the treatment options.
Yes, and it is actually, I mean, IVF is expensive globally, but Nigeria is more affordable in comparison to many other countries. That's also something very important to
yeah, definitely.
Yeah.
Couples say we're going to do an IVF in the US, for example. Now you're getting ready your either $50,000 or even above. But definitely, these are readily services are readily available. We know that IVF is not cheap anywhere in the world, even in Nigeria here. But these have been made available as much as possible, considering the pocket of Nigerians and people coming from outside the country as well. And of course, it's not just about the pricing, because we know that based on our core values, we are offering excellent services. And definitely excellent. We're not going below that. We don't fall below par at anything we're doing, and making sure that we don't drop the ball in anything we're doing. So the excellent service is there. So people will not even look at the cost, because you're coming in already. You're missing something excellent already coming in. You're meeting a group of professionals that are ready to attend to you professionally and ready to offer what is readily available, and that of course suits every couple. So it's something that we don't play with at all. That excellence as a core value, it's important, is at the topmost part of our minds, and in everything we do, we make sure that we display that.
I can actually testify to that, because I know lots of people that have been to your clinic and they had really excellent service. But even I know that recently you also had an audit or something.
Yes. So
and they got 100%.
Just some days ago we had a recertification audit. And I mentioned about our executive vice chairman earlier, Dr. Richardson Ajayi, and quality management is something it doesn't play with at all. And it makes sure that everybody that comes into the Bridge Clinic understands the importance of quality management. So it's not just about saying quality management. What exactly is this quality management? It's not just about saying, oh, we have quality. What does it mean? What does it entail? You have to have papers and certification to make sure that that is really what you do. So it's not about just have this paper. This is what we live. All right, and we've been on this for years. And recently, of course, we had a successful re-audit, which was a huge milestone. And what it means is that, of course, we are still globally accepted. We have not come down with our services. We are just moving to the next step, and has been innovative is the next step in our approach and whatever we do at the Bridge Clinic. And it's just congratulations as well, because it also coincides with our 25th year at Bridge Clinic. So it's really a lot to celebrate with. Thank you very much. It's really a lot to celebrate with this recertification audit.
Well said. Thank you. I just thought to know that as well.
Yeah, that's great. That's great.
When we talk about, we're speaking about donors, though, egg donors, sperm donors, I think one of the concerns for people is, well, is my potential child or children going to potentially date a half sibling because the other person used the same donor? So people are always concerned, how many people, is there a limit to the number of families that each donor is allowed to create? Is there a limited number of people that use one egg donor or sperm donor?
Yes, definitely. We must always have control over everything that we do. And as much as possible, we know that in Nigeria today, we are still pushing it at the level of the assemblies, the House of Assembly and the Senate, to just make sure that we have a regularization and laws and guidelines as much as possible. Though we know that at the level of the Bridge Clinic, we operate under the AFRH, all right, which is like the Fertility Reproductive Association in Nigeria here, just to have guidelines to operate. And of course, it pertains to all our services, and we have standard operating procedures and protocols for everything that we do. So for the donors, for example, we make sure that you don't donate more than 3 times. The maximum is 3 times.
Wow.
Once you've donated 3 times, you cannot donate again. And even if you have donated at another clinic before and you've donated twice, it means coming to the Bridge Clinic, that's your 3rd time and your final time. And that is not just only to limit, as what you mentioned, just to prevent the risk of the consanguinity and things like that, dating each other, getting married to siblings, but also for their health as well. Very, very important. All right. We know that considering the economy, a lot of people want to use this and say, oh, I've donated here, but they need to understand the risk that are involved. And of course, there's a limit. So once you donated 3 times, you cannot donate again. And if you're coming in for an assessment, you want to come in for screening, because we have a very rigorous screening process for our donors that come in to donate. If we get that from the history, all right, or we've gotten that based on partner clinics that are involved, and you've donated 3 times, we cancel you. You cannot be part of this program again. And it's important they understand what is there. So even for the donors, they go through a counseling process. They meet with our doctors, they meet with our fertility nurses that are professionals in this area, to counsel them, to help them understand the importance of what they are doing, so that you are not putting yourself at risk. And at the same time, for our clients that are all over as well, to limit the risk of the consanguinity, they don't donate more than 3 times.
Thank you so much for saying that. That's really helpful, I think, because people want to be sure. And I love the fact that you also said that they also canceled. So that way they have a better understanding of why you're telling them there's a maximum time of 3 times, and also thinking of their health. So you're also prioritizing their well-being, even in that whole process, which is so important.
Definitely.
Thank you.
Thank you so much.
Now, for individuals and couples looking to come to Nigeria from outside Nigeria for treatment at the Bridge Clinic, do they have to be in Nigeria for a very long time? Is there a amount of time that they need to be there? Can they do some of the processes back home before they come to Nigeria? Or can you just share a little bit more about that?
Yeah, so because we're having quite an increased number as well, Bridge Clinic, as you said, is all over. We're getting calls from the US, Canada. I told you that about some clients that came all the way from Canada just to have treatment. And sometimes because they have to walk and they're also trying to achieve a conception, it could be very, very challenging for them. So for every couple that we treat and we manage, there are different forms of processes just to assist them and help them. So most of the time, some of this couple, we just tell them, you can do your test over there. All right, we can always arrange virtual consultation. So of course, the world has moved to very, very small, global now. It's a small village. I can speak to the next person, but we're talking about Zoom right now. So we do a lot of virtual consultations. We do virtual consultations to even review these results. Sometimes they have to do their scans over there just to try and limit the time. And of course, by the time we look at these results during our discussion, we can schedule a treatment plan. Because of course, for an IVF protocol or for an IVF treatment, there are different protocols depending on the results. All right. You want to also make sure that their weight is at the appropriate weight before coming in. You don't want a client coming all the way and discover, oh, I'm sorry, you can't start treatment because you're not have the ideal weight. So we want to make sure that, especially for international clients, because of the time they have, sometimes they have to do quite a number of their tests over there, scans. And for some of them, like for example, those in the UK, for example, once we send a prescription, they are able to recognize this prescription, and some of them are able to even start their medications over there. We do virtual injection teachings for some of them with our nurses, where they are taught how to take these injections. We send them videos as well so that they fully understand the process, and this helps to shorten their stay as well. We know that approximately about, for a full treatment to happen even here in Nigeria, for some protocols, it might take about 5 to 6 weeks. But some people don't have that luxury of time. How would they spend and take off for 5 to 6 weeks? Who will give them that leave from where they are working in the US to take 5 to 6 weeks? So this also helps them. So if they're able to study injections, we're able to review their results. This may shorten their stay. Sometimes some people stay for about 3 weeks. Sometimes they're even able to do their scans. Some of their scans, they're able to do it, and we're able to verify some of these scans. And sometimes you see some couples who come in and spend maybe just 2 weeks. They're able to do their processes, have their eggs collected, have the embryos transferred, and they go back to their pregnancy test. So it's quite important to manage our international clients where there's a challenge of having that time. Time is a constraint for them. So everybody has an individualized treatment plan to help them, assist them so that we can manage their time for them. It's important for everybody because that customer satisfaction is very, very important. And this is also important in our counseling process for all the fertility doctors that attend to our clients. They're able to understand what exactly is their own pattern, what exactly is their own challenge, what time do they have to take off. And this helps them to also manage the expectations so that they're not having a plan to spend 4 weeks, at the end of the day, are spending 2 months. and it disrupts the whole process of their plan. So that communication is what we also put a lot of importance on when we're engaging our clients to help them to understand that you don't have to take all the time off, all right? We can work out a plan. What works for you is what we can do for you, and what works for you depends on all the investigations or the results. By the time we're able to review these results virtually, we can, of course, organize a treatment plan, what suits them, and able to assist them to just help their journey to be less stressful.
Thank you. It seems like the Bridge Clinic has sat down to actually understand.
Yeah, we've come a long way. Yes, we've come a long way. So people coming from all over, we're able to understand what exactly you need and what exactly works for you, and we're able to institute that as much as possible.
Yeah, it seems like you have every corner covered because,
yeah,
again,
definitely.
You highlight the fact that you work to tailor things. You don't have one approach for everybody. You find a plan, a protocol that works for each individual, taking into consideration their situations, but also stressing the importance and the counseling that you keep saying that you ensure that your patients have, and that's really important. That can change the entire experience in the fertility treatments. Because again, like you said, it is very challenging. People don't want to be in that situation, but if they're there and they realize that that clinic is doing everything within their power to support them and to tailor the treatment to their own situation, then it makes a huge difference.
Definitely.
In the whole process. So
definitely. And they just put smiles on their faces. As much as possible, we know what it takes to have to take time off work, travel all the way, and you still have to take injections, you still have to take tablets. So if you can make that journey easier and less stressful, then it gives us all the fulfillment as much as possible. And it just is a huge milestone that we've achieved, where we're getting international clients in that come all the way from different parts of the world, and we're able to assist them to achieve their dreams.
Yes. Thank you for all that you're doing to all our locals in Nigeria and even across the world. Thank you.
Yes.
For anyone listening right now wanting to reach out to Bridge to have that consultation, either virtually or in person, what is the best way to proceed or contact the clinic?
Yeah, so there are different ways. We have the WhatsApp platform as well. Of course, all our social media handles are available. Instagram, Facebook, WhatsApp is available. They can also even book. We have what we're doing right now, a free virtual consultation for 15 minutes that you can actually book from our website. So that can be booked as well, where you have somebody engage you just for about 15 minutes, totally free. We're not charging you for that. All right.
Amazing.
Totally free, where you can just engage someone for 15 minutes and the person will just give you an understanding. And of course, that is linked to a Calendly, where we now have people that have these conversations with you, and it's just to make them understand the basic processes and be able to, without paying, first of all, because of course, if you have to see a doctor, you have to pay for that. But these professionals will engage you, make you understand the simple processes of what is involved, and of course, make you come in to book an appointment. So we have a website they can go to at www.thebridgeclinic.com, where they can see all the services that are available, then book an appointment, of course, or sometimes you can just send WhatsApp. Send a message to WhatsApp. Someone is ready available to engage them. And of course, for the WhatsApp number, +234, because it's Nigeria, 08104607791. Definitely someone will reach out to them. You can also send an email. All right. You can also send an email consultation. That's consultation @thebridgeclinic.com. Once they send an email and a request for a consultation, definitely someone's going to reach out to them to have them booked. So we have all these platforms that are available. So if you are the Instagram person, you're the WhatsApp person, the Facebook, we also have the Twitter account, and of course, the website available for them. And all these platforms are just to make life easy for everybody, that you can always find a way of booking a consultation and find your way down here to the Bridge Clinic.
Love it. Yeah. I'll put all the details as well in the show notes so that people can reach out and connect with you.
Yeah, yes.
So Dr. Ogunniran, I know that you said so much to us today. You know, you shared so much information about the services that you provide, but I just wonder, is there anything else that you want to share about the services you provide, or any other information you want to provide to us before we wrap up?
Yeah. So in addition to the counseling, the fertility services, as I said, sometimes some people just want to have like an individual background of what exactly is going on at the Bridge Clinic. All right. So sometimes we have what we do regularly, usually once every quarter. We call it a welcome forum. All right, where couples come from all over the place just to have an understanding of what exactly is going on. It's almost like also a free consultation, because you're going to meet a fertility expert that's going to talk to you about what we offer at the Bridge Clinic, and also make them understand what exactly is going on in their body as well. And of course, people now have that open environment to be able to ask questions. All right, and of course, it also gives like a form of peer-to-peer support, where you're having people come in. It's not just me, myself, that I have this challenge. There are other couples, a lot of people that have a challenge coming together. And so meeting with the fertility expert, the nurses, the counselors, we're able to have a discussion where we allow for questions. All right, we're not charging you. You know, anybody now, even though I'm going to speak to a lawyer, he will tell you this is my fee before you even ask any question. So it's a forum where people can come in, ask their questions, listen to engagement, even listen to testimonials, where you have people that have gone through this treatment having to give their testimonies. Oh, this is how it was for me. It's not just coming from the medical side of view now, coming from somebody that has actually gone through the treatment. So being able to listen to these testimonials also gives them that motivation that, yes, it means there's a way for me. It means that I can achieve my dreams. All right. So these are just few of the services that are available. And of course, we said counseling is free, as I said, for example, cryopreservation, a lot of these things that are coming up now, that are just making it readily available so that everybody can access, no matter how old you are, no matter how young you are. There's something available for you to test for. So we're having people coming in even their teenage years, all right, coming to say, I just want to know what is going on with my body, all right, and just coming in as well. We're not discriminating against anybody. You can come in, have your test done, and have somebody speak to you, and have somebody counsel you and put you on the right track.
I was just nodding. I couldn't believe all the things you were saying.
It's quite interesting. Very, very interesting. Very, very, very great.
Wow.
Yeah.
And you mentioned so many amazing services that you provide for that forum as well, and speaking to people that have gone through that whole process before, because the thing about infertility is so isolating. There's so much stigma attached to it.
A lot of people don't want to come out. A lot of people don't want to come out. We know in the US, some people will even come out, celebrities will come out and say, yes, I did IVF. Yes, I did surrogacy. But in this part of the world, it's still something we're trying to do with communication and with this podcast, for example. Now, it's just to give people information that no, you don't have to suffer in silence. You can come out, and people are going through it. It's not just you. Celebrities also go through IVF. Infertility does not just say it's for the poor or for the rich. Everybody is affected by infertility. So people used to think about it as a black thing, but we know that it's all over in the world. It's from everywhere. We have white couples that have challenge with infertility, and it's not just infertility, as I mentioned. We know because of a lot of things that we're exposed to, cancer treatment as well, for example. Crop preservation, as I mentioned earlier, is something that is readily available as well at the Bridge Clinic. So it's for everybody to understand that, look, there's a solution. So if you're in that tunnel, it's not all darkness throughout that tunnel. There's light at the end of that tunnel. You just need to take a step. It's just taking a step, taking a decision that I need to take that step, and we're reaching out to you. You need to take that step. And once you take that step, we're ready to go along with you through the journey to support you, not just with this treatment, but emotionally. A lot of things that has to do with infertility also has to do with a lot of emotional management, all right? Yeah. And emotional management is also key. We want them to be in a good state of mind in preparing themselves, their minds, their bodies, their souls for this treatment at the end of the day, so that even as the journey goes, there are a lot of things that may come along the journey, but if we're ready and we're readily available and they are ready as well, we're ready to support them through the process, and of course having them to come back, because we've seen a lot of people that have come back, have their first baby, their second baby, their third baby, all right, through the process, and that's why we're here.
Thank you. Well done.
Thank you so much.
I know anyone listening right now is feeling reassured and feeling comforted that whatever they're going through, you have options and you're ready to work with them. Thank you.
Yeah, definitely.
And thank you for making your clinic so patient focused.
Yeah.
You really understand. It seems like you've taken the time to understand the impact that infertility has on people, and you've created ways to try to manage that to make it easier as much as possible. Thank you.
Yeah. Thank you so much. Thank you so much.
And as a wrap up, Dr. Ogunniran, I wonder, for any individual or couple going through infertility, listening to you, do you have any word of encouragement that you'd like to share?
Yes, I want to say, as I always say, I've been in quite a number of conversations like this, and I always say, you got to stay motivated, you got to stay strong, and you got to take a decision, all right? And the decision starts with you. We're available. We have trained professionals, doctors, nurses, counselors, embryologists that are ready to assist everybody that is coming in. So I want you to stay strong. I want you to have that belief, that strong belief that we're here to support you. And because we have our core values that we stand by, being honest, being innovative, being excellent, and being ethical, all our processes are tailored to these core values to just make sure that we're helping couples to complete their families. We know the challenge is over there, it's all over the world. There's a lot of pressure, both externally and both internally as well. A lot of people may not be ready to come out internally to tell you about what they are going through internally, but it's actually a lot. But that is why we're here. And just take that bold step. My notion is always take that step. Take that step. Until you take that step, you can't get to where you want to get to. So you must take that step. You must see your journey. You must see where you're going to. And that's why we're here to give you and guide you. And once you have that guideline, we're able to support you through this process. And I want to say, I want to encourage every couple, everybody that is out there. You have the challenge with infertility. You're having challenges with going through crop preservation. All our services are available, tailored to the best of processes, just to assist couples worldwide. And that's why we're here. We're here to help couples, and we're the leading fertility brand you can trust everywhere worldwide. And we're here as Bridge Clinic, and we'll be there forever by God's grace. So we're ready to support you. Just come in. and we'll definitely put you on the right track.
Amen. Thank you
so much. Thank you so
Thank
much.
you so much, Dr. Ogunniran. This has been amazing. We've all learned so much. And I think for everyone going through fertility issues right now, they are reassured that there are options, because again, oftentimes you don't know where to go, or you get some test result from a lab and you're not sure if that means there is no way out. But, listening to you today, as said, man or woman, individual or couple, there are options.
Definitely.
And they just need to take that step and come to you. So thank you so much for taking
taking
the time to be here with us today and to enlighten us about all you're doing. And thank you for Virginia Bridge Clinic for understanding the support that patients need and for putting everything in place to make things as easy as possible.
Yes.
Thank you.
Thank you so much. Thank you so much for having me. I hope I'll see you soon again.
Yes, I look forward to having you again in the near future. Thank you.
Thank you so much.